I'm going to palpate the radial head. What I'm going to do is take the patient's arm, walk down the humerus, find the lateral epicondyle. There'll be a little divot, and then the radial head. And to make sure I have it, I'll have the patient turn their arm. Relax. Lateral epicondyle. There. And I feel the radial head underneath her arm moving. All right, now I'm going to palpate the ulnar collateral ligament. The ulnar collateral ligament stabilizes the medial elbow. If I want to, I can put some translation on it. There we go. Find the joint line. Come over here. We're going to find the medial epicondyle. There's two strands that make up the UCL from the humerus to the ulna. All right, I'm going to measure elbow extension. What we're going to do is we're going to find the lateral epicondyle in the joint line. That's going to be our axis of rotation. The movement arm is going to go down the radius, and the stationary arm is going to go down the humerus. So what I'm going to do is, can you extend your elbow, please? Good. Looking at it a little bit. Do it again. All right. She should be around 0. So what I do, I get all set up like so. Find the lateral epicondyle. There we go. Movement arm. Stationary arms up the humerus. Turn your palm up. Get -1 degrees of extension. Now I'm gonna take a range of motion measurement for pronation. So the first thing I want her to do, can you roll your arm over for me? Just your wrist, good. And come back up, thumb up. So she's able to perform the motion. And what I'm gonna do is the stationary arm is gonna follow her humerus. The axis of rotation is distal to the carpals, just past the styloid processes. And what she's going to do, good. Relax. There you go. Stationary arm. Lined up with the humerus. All right. And then we're gonna try it again. There we go. Line it up with the humerus. And she's right at 70 degrees. Now I am going to do manual muscle testing for the biceps brachii. The patient's going to have her palm up to isolate the biceps. What I'm going to do is take one hand and support the humerus. Can you bring your arm up for me and all the way down? All right, up, all the way again. There you go. She's a 3. Put her right here. Now what I'm gonna do is I'm gonna put my hand on her forearm and I'm gonna tell her, don't let me move you. Okay. I'm gonna go 1, 2, 3, hold, hold, hold. Don't let me move you. Okay, 1, 2, 3. Hold, hold, hold. I could not break her, so she's a 5 out of 5. Now I'm gonna demonstrate handheld dynamometry for elbow flexion. All right, first thing I want my patient to do is, can you extend your elbow and pull it all the way up? Good. Now we're gonna get about 80 degrees right here, distal to the forearm. I'm gonna place the handheld dynamometer. I'm gonna brace up against my body. So, and then she's gonna push against the machine. All right, so right here, bracing against my body, keeping her arm down. On 3, I want you to push as hard as you can for 3 seconds. 1, 2, 3. Push, push, push. Done.